Welcome to the video Heart Health Checks Quality Improvement Activity. In this session, we will cover implementing heart health checks as a quality improvement activity in your general practice. Come away from this video with a better understanding of PIP QI Guidelines, heart health checks, Plan, Do, Study, Act methodology, and polar searches. Our guest speakers for this video is the Eastern Melbourne Primary Health Network Digital Health Team and General Practice Support Team. Eastern Melbourne Primary Health Network acknowledges the Wurundjeri people and the other people of the Kulin Nations on whose unceded lands our work in the community takes place. EMFN respectfully acknowledges their ancestors and elders past and present. We recognise and value the knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them. We celebrate their strengths and resilience in facing the challenges associated with their recovery and acknowledge the important contribution that they make to the development and delivery of health and community services. For our session today, we're going to cover implementing heart health checks as a QI activity in your practice. We'll be sharing the presentation between the digital health team and the general practice team. What we're going to be covering today, as you can see now on the screen, is on the agenda is the PIP QI Guidelines, heart health checks, Plan, Do, Study, Act methodology, polar searches, and what resources are available. Each participant will send, so let's get started. And I'd like to pass over to our first speaker, Julie.
Thanks for that, Ange. Welcome, everybody. I'm just going to start, as you can see on this first slide, with a brief explanation of the Practice Incentive Program Quality Improvement Stream. This is a payment to general practices that participate in quality improvement activities to improve patient outcomes and deliver best practice care. There are two components to general practice needs to meet to qualify for the PIP incentive payment. The first one is to participate in continuous quality improvement. The PIP stream rewards general practices for undertaking quality improvement activities in partnership with their local PHN. Practices are able to complete their own quality improvement activities, but these must be informed by their clinical information system data. And if requested, practices must be able to provide evidence to support eligibility, which includes retaining your documentation for up to 6 years. So every quality improvement activity you do, just make sure it's documented somewhere or held in a file or on a desktop, because you can be asked to produce it. The second component is sharing your is providing your PIP eligible data set to the PHN on a quarterly basis. Below is a link to the guidelines from the Department of Health. We won't go through the guidelines, but there's a link there should you need them. This is pretty self-explanatory. These are the PIP quarters, and you can see that at the moment we're in quarter 3, May to July, and the previous quarter is paid in the next quarter. So you should have received the February to April quarter in May. I don't know if it's been received yet, but it should be on its way. This PIP quarter, we thought it would be an opportunity to promote a heart health check to coincide with Heart Health Week, which I think was from the 2nd to the 8th of May. And given the recent media coverage over the death of Shane Warne, it's a good opportunity. I think a lot of practices have had people coming in wanting the heart health check, so it's great to have that happening. You can see on the slide that there's some stats on cardiovascular disease. And if it's not in the top 3, it's in the top 3 of chronic conditions in Australia today. So increasing the number of patients having a heart health check will also improve quality improvement measure 8, the proportion of regular patients' information recorded to calculate their absolute CVD risk assessment. This is a great assessment to undertake, as it also captures the cohort of patients not eligible for the 45 to 49 health check or the 75 plus health check. So what we can do is try to perform regular heart health checks with your GP to help patients better understand the risk of heart attack or stroke. Here is the link to the descriptor for the Healthy Heart Check, and always remember to check the descriptor for patient eligibility. So the intention of the 699, the heart health check, is to identify cardiovascular disease in people not known to have CVD. And this can be done for Aboriginal and Torres Strait Islander persons 30 years and over, and for all adults 45 years and above. So I'll read this slide as it tells you what is involved in a heart health check as per the descriptor. Professional attendance for a health check by a general practitioner lasting at least 20 minutes and including collection of relevant information, basic physical examination including recording blood pressure and cholesterol, initiating interventions and referrals as indicated, implementing a management plan, and providing the patient with preventative health advice and information. So now we're going to switch to a short little info.
Heart disease is the leading cause of death in Australia. Many people may not know their risk of developing heart disease, especially since you often can't feel risk factors like high blood pressure or cholesterol. The good news is that common types of heart disease like heart attacks as well as strokes could be prevented through regular heart health checks with your GP. If you are 45 and over and do not already have heart disease, you are eligible for an annual heart health check under Medicare. Aboriginal and Torres Strait Islander peoples are eligible from 30. A heart health check is a checkup performed by your GP that helps you understand your risk factors for heart disease and estimate how likely you are to have a heart attack or stroke in the next 5 years. Don't worry, you're not going to have to run on a treadmill or have any surgical procedures during this visit, and it only takes about 20 minutes. A heart health check usually involves having your blood pressure, cholesterol, and blood sugar levels checked. You will also talk about your medical and family history, as well as your lifestyle, what you eat, how active you are, whether you smoke or drink alcohol, and if you are maintaining a healthy weight. Your GP will estimate your risk by putting this information into a calculator and will let you know whether you are at low, moderate, or high risk of having a heart attack or stroke in the next 5 years. Your GP or nurse will develop a plan of short and long-term steps to help you lower your risk of heart disease, like ways to be more active, quit smoking and maintain a heart-healthy diet. They may also refer you to a dietitian or prescribe medication if you are at higher risk. Keeping your heart healthy, whatever your age, is the most important thing you can do to help prevent and manage heart disease. Take the first step to protecting your heart by visiting your GP for a heart health check today.
Thanks for that information, Julie. That was a great outline. The Heart Foundation has a toolkit with all the resources you will need to assist you with performing the checks. They've gone to a lot of trouble to put together a really comprehensive toolkit, and I encourage everybody to have a really good look at it. The toolkit has a range of resources to assist you to implement the heart health checks in your practice. These include templates to import into best practice and medical director, patient invitation letter templates, patient brochures, posters, videos, and numerous other helpful resources. Don't worry, the link will be distributed with the slides. So here is an example of a flowchart. This is a terrific handy tool. It'll help you to map out how you want to implement the heart health checks in your practice. We've also got some wonderful polar resources available to help you identify those eligible patients. You may want to focus just on a small group at first, particularly the 50 to 55-year-olds. As quality improvement is a whole of practice activity, you might want to start by getting the team together and identify your why. Why do you want to offer heart health checks at your practice? Could it be from personal experience? You might want to change your approach from a reactive to a proactive focus on improving patient outcomes. Maybe you want to start enhancing how you use your nursing team. Does everybody in the practice understand what a heart health check is? Will your receptionist be able to answer patient inquiries? Remember, the Heart Foundation toolkit that we just had a quick look at has a range of resources for your practice to use. This also includes scripts for your admin staff to answer any inquiries and letter templates for you to send out contacting patients. Just before you do send out any invitations, have a think about your room capacity and your staff availability. How many appointments can you make each week? Maybe your clinical team might need a quick refresher of where to enter relevant clinical information in your software. And who will set the reminders to ensure patients have the follow-up appointments as necessary? Most of all, don't forget, please reach out to your MFEN facilitator. We are here to help. If you don't know who your facilitator is, please let us know who you are and your practice name in the Q&A section, and we'll link you in with your facilitator. We've also put together a PDSA template for you for implementing heart health checks in your practice. Some interesting MFEN catchment data that I was surprised when I found this out, but only 35% of patients have the necessary risk factors recorded. Remember, that's cholesterol, blood pressure, and BMI to enable an assessment for cardiovascular disease. Remember, you will need to collect baseline data. The instructions for using Polar to track this are in the PDSA. And when the PDSA is complete, remember to reflect on your activity. Think about what worked well, what didn't, what might you need to change. Don't forget Basecamp. Let's use our Basecamps to keep the conversation going and supporting each other. Share your resources with other practices. You all have the same goal. Barb, have you got some Polar tips to share?
Thanks, Leonie. I do. But firstly, just wanted to touch on the first step, which is to ensure that all the measures are recorded in the correct area in your software programs and not just in your progress notes. And if you're receiving scanned documents, you'll need to add the measures into the clinical notes under measures. And that way they are captured. Ensure you have these conversations with all of your staff before commencing the activity. And we do have a little tool called Walrus available. It's available to all practices using Polar and will prompt at the point of care for missing measures. And recently, Outcome Health added the healthy heart check into the little reminder under the MBS piggy bank icon. So it will remind you, it will give you a prompt if you click on that little piggy bank icon when the patient's in the practice. It will tell you whether they are eligible for a heart health check and whether they've had one or not. So Walrus is available free of cost for all practices who have Polar installed and are using best practice or medical director. And if you would like assistance with installation and use of Walrus, contact Digital Health at that inbox there, digitalhealth@mfen.org.au, and we will be able to assist you with that. So just going to do a little demonstration of where you're going to be able to identify patients who are eligible for a heart health check. So log into Polar using Google Chrome, select reports, which is the little on the top left-hand side, just next to the Polar icon, and then you will see a list of your reports and the clinic summary tile, which is just down the bottom of this slide here, is the report that you need to select. I just should mention you don't need to write anything down. We will be providing a walkthrough to all participants when we send out your links to the presentation and other resources alongside. So once the data has loaded, you then select the MBS icon and tracked MBS. And also don't forget to select the little shortcut button on the right-hand side, which is RACGP and practice active patients, which will then load your active patients and your patients that have been 3 or more times in the last 2 years. So you may or may not choose to do that, but I think you're going to find you're going to have a lot of heart health checks that haven't been done. So it's probably best that you put that RACGP active filter on as well. And then you're only working with your regular patients. So once the page is loaded, you'll see in the table up the top that the focus will load to GPMP, but we need to change that focus to a tracked MBS item, the heart health check. So to change that focus, you just click on that line. And in the middle section, you will see the 2 action radio buttons with options to select patients that are eligible but have never had a heart health check, or patients that have had one over 12 months ago and this has now expired. Or you can select the combined button, and that will give you a combined list of both of those patient cohorts. You can consider adding additional filters if you have large numbers of eligible patients, or you can stagger the invitations in other ways. You can apply an age filter in the search or the table, or use the walkthrough on our website on how to export, format and print patient lists on this link. For example, you may want to start with patients in a specific age group, or you can apply an age filter in the table if you wish to do this, or use the walkthrough Polar search lists export format print, which is on the EMPN website to filter further. So the exported list will populate with both patient IDs for SMS purposes and email addresses. If you're collecting those, you'll be able to send the invitation letters with a brochure attached. If you decide to do this, just ensure that you use the BCC function if you're going to send out bulk emails. And be mindful of sending out too many emails at once. You may want to stagger them to suit the practice capacity, so you're not inundated with hundreds of phone calls if you send out hundreds and hundreds of emails at the one time. So to check how your practice is tracking with the quality improvement measure 8, you can use another Polar report, which is the PIP QI report in Polar, and then you select the CVD heading up the top right-hand side there, and that will graph your improvements by the months. And this is a little fun fact on this slide as well, that the proportion of regular patients with the necessary risk factors, as Leonie said, recorded to enable the CVD assessment in the EMPN catchment, we can see by years where that has tracked, but interestingly, we recognise that a lot of patients due to COVID have not been attending practices, so we've seen a slight dip, you can see in those percentages, as they're measures that need to be done with patient attendances. So in summary, heart health checks can be done annually. A GP management plan and a heart health check can be done on the same day. The nurse time to collect measures counts in the 20-minute assessment time. You can bill privately for the heart health check. You cannot claim, just be mindful that you cannot claim another health assessment item in the same calendar year. For example, the 45 to 49-year-old or the 75 plus health assessment, you cannot claim those in the same calendar year that you claim the heart health check. You may want to capture other at-risk groups, example, the 50 to 74-year-olds. The Heart Foundation also has a webinar on implementing heart checks, and we've got that link to that webinar below, which we will distribute to everyone. So this is our QR code. So if you take a photo of that QR code or scan the QR code, it will take you directly to the Polar page on the EMPN website. And this is where you will find all of our Plan Do Study Act templates, all of our walkthroughs, and all of our other Polar resources. There also is a short video on walrus on that page as well that you can have a look at. It's only 2 minutes long, and it gives you a demonstration of how walrus works. And remember, the PHN team is here to help. We can guide you through the activity. So I'm going to ask Seti Ramos, who is the nurse from Medi7. She is has very kindly offered to talk to us about how they have implemented the heart health checks in their practice. Thank you, Seti.
Hi, Barbara. Thank you for that. So, with Medi7 clinics, of course, during the first year of the heart health check program that was implemented by the government, we had trouble, catching some patients who would like to have their heart health check because they don't have knowledge about it. So what we did initially, of course, we start by educating everyone how to implement a heart health check. It does not include only the doctors, the nurses, but everyone working in the clinic. So we need to make sure that everyone has the right attitude towards the new program, has engaging attitude about it. And of course, we need to have teamwork to provide high quality care to all our patients. And aside from that, we also develop our main goal for this program. So it's to be advocate against chronic illnesses, to save lives and to protect the public, to decrease the mortality and morbidity rate here in Australia related to cardiovascular illnesses. So we ended up our decision to just do it on day-to-day basis, like prompting the appointment of the GP, checking patient who is eligible, and we do that on the same day. So of course, we explained it to the patient. It is going to be 20 minutes. And then after doing the heart health check, they have a chance to discuss it further with their doctor.
Did you have any learnings or anything you can share, Seti, like what didn't work or what did work, or any issues?
Okay. So for that one, at first, we tried using the Polar and as well as the Cubicle and our new program, which is the Hot Dog. We send them messages, SMS for them to come to the clinic to book for their heart health check. But the problem there is the age group of between 30 to, let's say, 74 years old, they are busy doing their job, they're busy with their schedule. So the problem that we usually encounter, even if we send them messages, maybe out of like 10, there's going to be 2 who will book their appointment with us. But what's working with our clinic is prompting the appointment of the doctor, and then the nurse will have an initiative to do the heart health check on the same day. And
so you use your appointment book to check if the patients are eligible and if they've had a heart check.
Yes, so we do it on daily basis. Like we do the initial assessment by checking their history, if they're eligible, if they are 45 and above, if they haven't had any cardiovascular issues, if they've done the lipids within the last 12 months. So that's our initial assessment to encourage patient to have the heart health check.
And have you found the patients are open to having that done at because it's less intrusive? I guess they can have it done while they're having their appointment, or
as long as we explain it to them, they're happy to do it. And of course, we inform them it's going to be 20 minutes, the combination of the nurses' time and the doctors. And at the end of the day, they usually just be happy with the heart health check.
That's great. I think that's what even Walrus, I can see that Walrus would actually be able to help a lot of our practices. If you find that's working for you, that prompting the patient when they're in the practice already may be a good workaround for that. Well, we may have some questions for you, Seti, as well. I think we'll probably come onto the questions. If anyone has any questions, if they could type them into the Q&A function, and we'll be able to read them out. So someone has said, and I think if you could answer this, Seti, this would help me. How do we define cardiovascular disease? Most of our patients have hypertension, high cholesterol, but I believe we can still do the 699 for them.
Yep. For the cardiovascular illnesses, we all know that hypertension is part of the cardiovascular disease, but further assessment, like we all know that heart attack is a silent killer, just like what happened to Shane Warne.
Yes.
Yeah. So we can still do the 699 even if they have hypertension, because being hypertensive, it will lead them to have cardiovascular diseases in the future.
Okay, there's another question here for you, Seti. It is, is an ECG required to complete the 699?
It's not really necessary, but if you think the patient needs it, then just do it.
And then in which circumstance we cannot perform a heart health check? From my understanding, if a patient visited a cardiologist in the past, patient will not be eligible for the heart health check. I don't think that's quite a limitation.
Yeah.
Is that to you?
The limitation only for the heart health check, if they are diagnosed to have heart issues, like for example, MI, of course, if they've had CABG or any surgeries. But I think with atrial fibrillation, it's fine.
Okay. Marta's also said, what is the actual definition of CVD? Well, cardiovascular disease. What? I'll have to have a look. I'm not sure what you actually mean, Marta. So then she said, for the purposes of not being able to do a 699 anymore. Oh, I think I know what you mean. I think it, does that make sense to you, Seti, or? Oh, okay. I think I might have to take that one offline, Marta, and get back to you on that one. Can we bill a heart health check together with a normal consultation, or does the patient need to book 2 separate appointments?
I think we can build that together with 699. The only thing we cannot build together with the 699 is the same health assessment. So like the 45 to 49, 75 plus health assessments.
Right. Okay, so I'm just going back to read them. I think we've kind of answered most of the questions. Oh, okay, hang on. So the exclusion criteria, basically lots of things contribute to cardiovascular disease, but looks like there are only a few conditions that mean we can no longer do annual checks. Can we claim a 10997 at the same time? So some of these MBS items, we're probably going to have to refer you on to MBS online for.
Yep. I think the 10997, we can bill it together with 699 as long as the patient has the ongoing care plan.
Right. So that's the nurse item, the 10997
yes.
for chronic disease.
Yes, that's correct.
So yes, that makes sense. Coming down. It is stated that you cannot bill a 45 plus or 75 plus in the same year. Is that correct? So I can take that one. That's definitely correct.
Yes, it should be after 12 months. If they want to do, like if the patient is due for the 45 to 49 health assessment and you want to do the heart health check, maybe just prioritize the 45 to 49 for now because it's only one off. And then maybe the following year or after 12 months, then we could do the heart health check.
That makes perfect sense. Thank you,
Yeah,
Seti.
of course.
And the 75 plus, you are much better off billing that over 75 health assessment. You cannot bill the two in the same year.
Yes, and you can do the heart health check together with 75 health assessment, so that should be all right.
My understanding is you couldn't do the 75 plus health assessment with a heart health check.
Yeah, but you could discuss it as well with the GP, with the patient, but not billing the 699.
Yes, that's right. Thank you.
Yeah, it's like comprehensive assessment. Of course, we need to assess the patient cephalocaudal with the 75 plus.
Okay. If a patient diagnosed with, she's written HTN, so I'm guessing that's hypertension, from the past, can we still do a heart health check?
Of course.
Can a heart health check be done in a known case of hypertension or AF, atrial fibrillation?
Yes, we can do it.
Is there a heart health check follow-up item number or review, please? Say if you chose to do a 24-hour blood pressure monitoring following a heart health check. No, there is no review item for those heart health checks.
But we can do that the following year because we can do the heart health check after 12 months.
I think we kind of come to the end of our questions.
And I can see another question. Is an ECG required to complete the 699?
It's not really necessary to do ECG every heart health check, but if you feel like the patient needs to have the ECG, then just do it. As long as the patient doesn't have any ECG within the last 12 months as well.
Thanks, Barb. What a fabulous session that we've had today. And I want to thank our presenters today, Leonie, Julie and Barb. And a big shout out, thank you, Seti, for taking time out of your practice today to be with us. So
that's
big
okay.
Thank you.
Thank you so much.
Thank you so much. So the Eastern Melbourne Primary Health Network team is here to support you for Polar and PIP QI, general practice support, and Health Pathways Melbourne. We thank you for watching this video.